new protocol that can help you improve your memory, prevent Alzheimer's, and in some cases, even reverse Alzheimer's. This is a really new idea in medicine over the past 10 years or so, and it comes from this idea that Alzheimer's may not be just one thing. When we say the name Alzheimer's, it makes us think, well, maybe it's just one thing. In fact, it looks like there are multiple problems that can lead to Alzheimer's, multiple contributors that can create a poor memory as we age. And the final common pathway of an increase in the amyloid beta that starts to crowd the brain of people with Alzheimer's happens when you have a bunch of inputs that basically turn the switch to on to make this protein. Okay, so what we want is as soon as possible in our lives to stop doing things that will cause the switch to turn on to make this protein. Because what's interesting about Alzheimer's has a course where it's gradually downhill, right? People's memory gradually fades until the point where it really goes quickly. And that's when we think of it as kindled, that your brain starts to make a lot of this amyloid beta protein and you stop being able to have the connections that you used to have in your brain. So this comes from the work of Dale Bredesen, an amazing neurologist in California. He is a wonderful author, speaker, teacher at the Institute for Functional Medicine, which is where I got my functional medicine, my training. And he wrote the book, The End of Alzheimer's. Okay, so a must-read book for all of you because you may not have been touched by Alzheimer's yet personally. It is a sure thing that throughout your life you're going to either know someone or have a loved one who suffers with Alzheimer's. And we want to do everything we can to create the resilient brain now so that we can keep our brain working well all throughout life. And so that's really what we're talking about. How can you optimize your brain? Nourish, move, rejuvenate, cleanse constantly, starting from a young age, because even when we're young, in middle age, you are already laying down these plaques. You are, okay? No matter what age you are, we find these in young people, and they will clog up your brain and make it so later on you're not functioning as well as you want to. So let's dive right into it. What is the protocol that Dr. Dale Bredesen would recommend? And this is something that he has a great website that goes into it. It's called Apollo Health. I encourage you to take a look at that, especially if you or a loved one is affected. But basically, he's got a plan, including something called the Bredesen 7. Okay, so the Bredesen 7, and those of you who are right now in one of my programs, you're going to recognize that the whole time what I've been teaching you is how you can take good care of yourself. Yes. How we can revert root cause, yes, but also how can you keep Alzheimer's away? Seriously, if you dial these things in slowly, right? It's all about the big picture, finding your one next thing and focusing on that and then repeating. Okay, if you start to do that in all the areas of your life, and pretty soon you're going to find yourself living a different life, feeling a ton better. And also, you're going to reduce your risk of Alzheimer's substantially. In fact, you're reducing your risk of all chronic illness. Okay, let's do it. So if you're going to reverse Alzheimer's, what are you going to do? First off, you're going to look at what are you eating. Nutrition is so important. And I've said this many times. It's like all about eat, move, sleep, right? We got to have those big basics. And once we get those big basics in place, it makes it so much easier for our bodies to do what they naturally know how to do, work well, repair itself, right? It makes our immune system work better, our metabolism work better. So nutrition, exercise, and sleep are sort of the cornerstone of the RECODE protocol. De-stressing, way important, y'all. So we need to find ways that we can, in the moment to moment, de-stress, right? So if you've been with me and been following me a little bit, you know I'm talking about those exercise snacks and the peace snacks. Maybe on the hour you're taking 4 nice slow deep breaths. You're doing a minute of an exercise snack, and know that this is going to help your brain in the long term. Not only that, of course, there are other things. Brain training. If you want to, you can get smarter no matter where you are, what age you are, whether you're young, whether you're old. The more you use your brain, you create something called cognitive reserve. And what we find is looking at people who are doing brain training, there's some interesting studies showing that it improves their brain function long term. We detoxify. I'm going to go into that a little bit more, but detoxification is important because we're actually exposed to a lot of stuff throughout our lives that we don't even know, okay? And supplements, within this protocol, there are a lot of supplements. And that's because folks who are hoping to reverse Alzheimer's are feeling like we want to try and support the body in any way that it possibly needs. And so when someone comes in, what's the difference between just general taking care of yourself and the RECODE protocol? I'll tell you about it a little bit more as we go through this. But supplements are one. There's quite a bit of lab testing involved to identify what do you really need. We don't want to give you stuff you don't need, but some of us have deficiencies. Some of us have toxicities. You need to identify those in order so that you can patch that hole. So, because from one of Dale Bredesen's talks, if a roof had 36 holes, right? For instance, if there were 36 things causing Alzheimer's, wouldn't you want to take care of all the holes in that roof? I.e., wouldn't you want to cover all the different issues for somebody who's having memory loss or memory problems? And so if we start to think about these things early, getting the bedrock, right, which is eat, move, sleep, get that metabolic health good, because we know that high levels of glucose, diabetes, metabolic syndrome can affect our ability to ward off Alzheimer's. We will see that people with diabetes are going to have a higher rate of Alzheimer's. So we want to control diabetes. And the metabolic health is the center of that triangle there, trying to drive home the idea that we need to have all of these in place. It's our root. So let's talk a little bit first about the diet. What is suggested in the RECODE protocol is something called KetoFlex 12-3. The KetoFlex 12-3 is pretty straightforward, okay? Keto refers to ketosis. Now, ketosis is when our body starts to use fat for fuel. And generally speaking, our body usually prefers glucose for fuel unless we become keto adapted. But a little bit of ketose actually helps decrease inflammation in your brain. And that's why this was chosen as a style of eating. Now, the flex refers to metabolic flexibility, and that is that we want people to be able to use both glucose or fat as a fuel source. It also is flexitarian, and that means that meat is optional. The 12 and the 3, what does that mean? The 12 is the minimum amount of time each day that you should spend fasting. Let's say, for instance, that you typically will eat a late meal at 7 in the evening, okay? So you would be naturally fasting from 7 after your last meal until the morning when you get up. And if you woke up at 7 and after that point you had your meal, that means that would be a 12-hour fast. Now, in general, I suggest trying to put a 3-hour window between your last meal and bed so you can make sure your stomach is really empty. And that is exactly what the 3 hours is. 3 hours before bed, you want to not be eating so your stomach is really empty. That means I'm almost done. I only got a half an hour longer. So 12 and 3, now you understand what that component of it is. Now with this, there are some recommendations on what to eat and what to not eat, and I'm going to go through these. Now this is also remember that wherever you are is okay. And if you're in my program, you are working on some kind of whatever nutrition program you've selected, that's your best next step, right? For those of you who are wanting to do the RECODE protocol, I'm going to tell you about what the suggestions are here. So we have a nice things to say no, all right? Not going to surprise you either, right? There's not any sugar allowed. No sugar, sorry. And if you're going to be strict about this, you're going to cut out grains too, okay? These are inflammagens, so is dairy. So conventional dairy, grains, and sugar, processed foods, right? Simple carbohydrates. These things aren't super good for you, right? And these days there are also a lot of pretty tasty substitutes. So we just got to hold out hope there. And if this is an overwhelming idea, you start slowly. Maybe you start by making one meal healthy, right? One meal fit the plan. And then once you get that one rolling, you go to adding lunch, right? So this is something that, depending on where you are on the memory scale, I mean, if you already have problems with your memory, you want to go whole hog, cut it out, cut out the sugar, cut out the dairy, cut out the grains. And so, what can you eat? Let's talk about what's in that. You see at the base of the pyramid here, we have fasting. That's the 12 and 3, right? It's 12 hours fasting at least. And then we have non-starchy veggies and healthy fats. They're the base of the pyramid. You can eat a ton of vegetables, right? All of you guys, nobody's eating enough vegetables. Okay, that's you. No, you're not. Okay. All right. Next on the pyramid, we've got prebiotics, resistant starches, and probiotics. Probiotic foods like sauerkraut, kimchi, good, so yummy. So you can see that already. You see this pyramid is way different from the one that is the American Dietary Association's pyramid. Way different. I don't even think they have that anymore now. They have a plate, my plate, right? Moving on up, next we have clean animal protein and fruits. You need to have enough protein. That is true, you guys. You need to have enough protein, and this can be done if you're a vegan or vegetarian. We just have to tweak it a little bit. One of the biggest challenges I see is that when people go on this and they go right on it, if they're already a thin person, they have a hard time keeping weight on. So note that healthy fats has to be really upped. Most of you guys who are dealing with cognitive challenges were alive during the 80s, and like that was the time when we were listening to what our doctor said, who told us not to eat any fat. And many times people just don't include fat in their diet because they still think it's not healthy. We need healthy fats. We need extra virgin olive oil. We need avocado, nuts and seeds. Those kind of things can be very good for you. So going up the pyramid, clean animal protein and some fruits, blueberries being best. Berries are best because they will help with your brain power, right? And then indulgences. When we're talking about indulgence, we're talking about just a little bit. We're trying to sweeten with things like monk fruit or stevia. If you're going to, chocolate does have some health benefits. So cocoa flavonoids can be useful. And, if you're going to do dairy, A2 dairy is the kind you want. It's less inflammatory. And if you're going to do alcohol, it should be rare because alcohol is it's a toxin. So rare, and it should preferably be sugar-free. Lower alcohol content is recommended. So that is basically the Keto Flex pyramid. Ta-da! All right, so moving on to other ways that are suggested and how you can prevent Alzheimer's. Exercise is a critical part of the plan. So when you look at this end of Alzheimer's book, you guys, you're going to look at it and you're going to go, what are all the supplements I need to take? And I'm going to say this a few times. Supplements are supplemental. It is actually the lifestyle choices that are much more likely, that combined with root cause resolution, removing the root cause, that's going to lead to your brain getting better. So exercise is critical. Exercise increases BDNF. We've talked about this week. It increases the growth factor that tells nerves to grow up, you baby neurons, and become grown-up neurons, right? We want to do everything we can to make that happen for you. So exercise is not optional. It's really essential. And when people are on the RECODE protocol and they suddenly stop being able to exercise, it doesn't bode well for them. And it is a very important part. And we'll talk about a few different ways you can exercise. Just generally moving throughout the day. Joyful movement, right? That's why we do our little exercise snacks. That's why we're dancing in the kitchen. That's why we're bouncing while we're doing dishes. And we're trying to stand up straight, hold our body strong with power, and really look at our day of where can I fit in some joyful movement? Where can I do a couple little bounces to make my body stronger and to help keep the connections going? Okay, so joyful movement throughout the day, exercise, snacks, keeping it fresh. Let's do some fun things. Pull in activities that you haven't pulled in for a long time. So our brain needs stimulation. And the more that we're able to find fun things that we really love to do it's more likely we're going to continue to engage in it. The other thing is that when you can do fun stuff with other people, right? When you get in a community or with a loved one, it gives you that community bond too, that or a friendship, a way that you can improve your social connections, which is a very big part of keeping your brain sharp. So keep it fresh, keep it fun, play games, do something you haven't done in a long time, you guys. And the next thing that is a new idea you may or may not have heard of. It's called blood flow restriction therapy. Blood flow restriction therapy is a way that a little bit of an exercise can seem like a lot of exercise to your brain. Okay, how do we trick our body into thinking we've done a really hard workout? Well, blood flow restriction therapy is it, you guys. So what you do, and you want to do this with a safe device. Now, I use Be Strong bands. They are very safe, and so you can do it at home. Some kind of, I don't recommend that you just get rigid bands to put on your arms and legs. Okay, so these are placed at the top of the arms, the top of the legs, and you wear them for a short period of time. The Be Strong bands you can only wear for a max of 20 minutes. Okay, so you wear them for a short period of time. I usually wear them for 5 or 10 until I get a strong I am tired signal. The strong I am tired signal, when I take those bands off, it sends neurochemicals to my brain saying, what did she just do? Although I'm not even really that tired, right? But my body thinks I've done a hard workout and it responds. So our body is going to change the chemistry that it's producing based on the idea that I just did a killer workout, even though I only worked out for 5 minutes with 5-pound weights, right? Okay, so we want to trick our body. This is how we biohack, y'all. So blood flow restriction therapy is definitely something that should be considered. You want to talk to your doctor about this. Make sure you're a good candidate for it. There's a few things that would keep you from doing blood flow restriction therapy. And you just want to speak with your physician about it. So hit me with your best shot. Come on. Okay, yes, back to the 1980s we go. High intensity interval training. This can be just calisthenics, and there's a great study showing that just doing some calisthenics in your home can make a huge difference in your overall health. But now that we understand this connection with nerve growth, nerve connection to exercise is so important. Now, when they say high intensity exercise, interval exercise, this is relative, right? For some people, high intensity is just getting up and down out of the chair. So you just got to take this at wherever you are, right? And this means that you go for a little bit and then you rest, right? And then you go a little bit more. And sometimes we'll just start off with one. Maybe you're going to do the Zach Bush 4-minute workout. I love you, Zach Bush. Yeah, guys, check out Zach Bush's 4-minute workout. It's amazing. All my patients love it. It's nice because it's short, right? You can do 4 minutes. And so he does this nitric oxide workout where he's got you doing little squats and bends, put on a little music, and then you're doing your arms like this. And it's fun, it's quick, and anything that gets us moving so that we don't feel overwhelmed, that's what we want. So hit me with your best shot, little high intensity interval training. Next on the list is really finding that mind-body connection. So you guys that are working with me in the transformative, Rebel Fast Transformative program, we're working on trying to connect regularly, moment to moment. Is this moment nourishing? Is this moment moving my body in a good way? Am I moving my mind, soul in a good direction, right? Are these choices making sense? Am I in coherence? So the coherence is critical, and it also helps do things that help your brain. Lowering cortisol by trying to help the mind-body connection is huge. And I can't go without mentioning cold therapy as a way we can increase our mitochondria. So when we're trying to optimize exercise, increasing mitochondrial density, and this person, wow, what a beautiful place to do a little bit of cold therapy, right? While watching the aurora borealis. You can do cold therapy. You don't need to have a setting like this, although wouldn't it be great if we all had a nice chilly lake behind our house? You could just turn the shower on a little cold though. Okay, so you don't have to do that. And start off slow with this, right? If you're like, I don't want to turn my shower cold, I love my warm shower, at the end of the shower, just turn it a little cold, right? And then you can do a little more next time, maybe a little longer. Um, Wim Hof, the Iceman. There's some good books on Wim Hof, the Iceman, how he combines breath work, and he was able to show that he could alter his immune system, being resilient to injected. They injected infection IV into his body, and he was able to control his body's response. The doctor said, "Oh, that's a fluke." Right. And so the reason I'm mentioning Wim Hof is because he teaches cold therapy and how to get your body able to tolerate the cold therapy because it has so many benefits. Well, Wim Hof, after he did his cold therapy, they said, "No, that's just you. You're just weird." He said, "No, I'll teach people." And so he took all these volunteers. He taught them how to do the thing, and they did the thing too. So it's pretty amazing. Cold therapy with breath work is such a powerful, more powerful than any medication that you can put in your mouth, you guys. So then, of course, what was the base of that? Like that first, not the pyramid, actually. Well, it was everything was on the bed, right? We need to sleep. That's when you clean out your brain. And if you do not have a good sleeping schedule, you want to somehow find your way to a good sleeping schedule, it's essential for optimal brain performance. So, really, we are talking about no matter where you are in your life, how you create best brain performance, sleep. It's the antidote to so much. So, let's get you sleeping better, and let's make sure that you don't have sleep apnea, right? Is it simple snoring? Is it something else? Now, if you're falling asleep in the middle of the day, that's not normal. Now, siesta, intentional, that's okay. But if you're falling asleep in the middle of the day, it's dangerous. Run. What if you fell asleep while driving? And you need to be checking out snoring. And this is one of those things that has to be remedied if you want optimal brain performance. Because if your oxygen levels keep dropping down in the night, that is it's doing damage to you, to your body, to your brain. Um, the other thing that's important to note, when we're not sleeping well, it's linked with depression. And if you want to improve your mood, one of the first things that I would suggest for you is that we get you sleeping as a first move. Now, the next question people also often ask is, isn't there a pill for that, right? You can't just take a pill. Unfortunately, sleeping pills are not good for your brain. No, 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 no. Well, benzodiazepines like Valium actually have residual cognitive depression problems with how your brain is working for years after you stop taking them. I know, right? It's not fair, but there's really not a medication. I don't think sleeping medications are a good idea. Many of the non-benzodiazepines will have anticholinergic effects, and these anticholinergic effects can affect your brain health too. So there are some safe supplements that can help with sleeping. Many people are deficient magnesium. Magnesium is a pretty safe one to consider trying, and thinking about how we can make your day routine lead into a good night is really where we want to start. Get your schedule on a regular routine. Wake up at a regular time. No blue light at night. I see you. No blue light at night. Okay. And just remember that when you start to get that sleep schedule better, it's going to lower your stress. It's going to let you be able to take more of a breath, because when we don't sleep, it plays with our cortisol, our adrenal function, our body's ability to respond to stress in a good way. So as you're learning to sleep better, let's also learn to breathe better. Okay, well, y'all have been listening to me, right? We're breathing in through our nose, breathing out through our nose. We want to try not to be mouth breathers, especially at night. And I want to mention that one simple way for some people you can get rid of sleep apnea is by simply putting a piece of tape across your lips and taping your lips shut. Now, they also make specialized sleep tape for this. Do you need it? I don't know that you need it. But we want to learn to be breathing through our nose at night, and know that if you have congestion, you need to take care of that. The more you practice breathing through your nose, the easier that will be. And I always mention the Othership app as a great breathwork app that can help guide you in how you can use your breathing to reduce your stress and feel better. And this is all part of that stress reduction. Is a critical part of the Recode protocol. And, it may be that mindfulness is where you live, and that mindfulness, being moment to moment, aware of what is going on in your life, being present. If you want to take it one step further, meditation has been shown to turn on and off genes, you guys. And so meditation is a way that basically you're quieting your brain. And in our run world, more meditation can lead to a quieter, better working brain. And let's see. Next thing is brain stimulation. Okay, so you guys, use it or lose it. Let me tell you that the things that are hard for you now, they are only going to get harder unless you start to do them more. So we've been talking also about this idea is that we have to incorporate brain training if we really want to optimize. Now, if you're okay with just letting life carry you as it is and continuing whatever trajectory you're on, then you don't need to do this. If, on the other hand, you see the future and you see that you're already having, using post-it notes to remember important stuff, if that's you, it's time to jump on the wagon and start training your brain. With brain training, using like Brain HQ, Lumosity, whatever. Yesterday we talked about some of those great kinds of games you can use. They're in books. There's lots of options, but getting a complete brain training program going is part of you optimizing your cognition when you're older. They've looked at people, and even 10 years later, a little bit of training, and we're talking like 6 to 15 hours of training now, affects your brain in 10 years when they compare people who hadn't trained and people who had trained. So you guys, it doesn't take long. It's not super fun, honestly. Okay, that's the biggest. Yeah, I wish I could say it's way fun, but you always lose these games because they're trying to push you to speed, and that's why Sudoku and to do the crossword puzzle are not quite as effective because they're not pushing you to speed. They don't use your auditory senses. They don't use your picture like visualization senses, and you want to try and use your whole brain if possible. So brain stimulation is important. Another lovely way to get brain stimulation is music. It can work many different parts, and it's way fun. I gotta put a plug in for music, and just if you can find a way to get that into your life, it's great. Okay, so this is the big thing for those of you who are in the transformation. Next week, we're going to be talking about detoxification, because what the hidden elephant in the room is that all of you guys are collecting toxins in your body throughout your life, no matter where you are. And for some of you, these are the reasons that you're going to have problems with your memory. As early as we can start to release toxins, avoid toxins, the less you're going to get in your body, okay? So we want to identify, and that's why I do check for toxicity, certain kinds of toxins. And, heavy metals is known to lead to brain problems. So heavy metals, mold toxins also definitely cause memory problems specifically. So we want to get those out. We want to make sure that we are having clean air, clean water, clean food. And if you're having medical issues, these days, the food source, organically grown food has like 75% less pesticides. So even organically grown food has some pesticides in it. So know that if you eat organic, if you filter your water, and I think a whole house water filter is a darn good idea. Get an air filter in your home so that you're breathing in clean air. Sometimes indoor air is actually dirtier than outside air in terms of toxins, depending on, whether there's mold in the air. And, the mold question is a really big topic. So I can't really go into all of that right now. But no, we want to have clean air, food, and water. And it's really important for your brain. Okay. Now, like I mentioned before, supplements, they are supplemental. You cannot supplement yourself out of Alzheimer's. That is not going to happen. I have some people who have come to do the recode protocol, and they're like, well, I can't do the exercise. I'm not really doing, I'm not sleeping that well, but I'm taking the supplements. That does not work. Okay. It might help for a moment, but for the long term, you need to reverse root cause. And that involves working with a doctor who can look at potential causes of memory issues and then decide what your body needs for support and then put these other pieces in place. So all of you who are on the road to the transformation, I know that you are finding ways to put in the eat, move, sleep, right? All that you're nourishing body, mind, and soul, so that you are going to be able to really make a big difference in what's going to happen in your brain as you get older. Because this is what we want. We want your brain to be nourished, moved, cleansed, rejuvenated, so that you feel like $1,000,000 and you can play with whoever you get to play with, right? And with the regenerative therapy that's happening right now, I mean, that might mean that you play with your great great greats. Wouldn't that be cool, right? Let's stay sharp all our lives. And the sooner you put this in place, boom, better for you. Thanks for listening, and I hope that you guys have a really wonderful day. Okay.